Today's topic is perimenopause. And the reason I chose this to start with is because the majority of you, my patients, and what I get asked about the most have to do with these topics around perimenopause. So that's why I decided to start with that. There's also, so much intricacies in between all of the topics that we'll discuss. So if you find yourself in this situation, or if we haven't talked about it already, and you realize like, oh, that's me, and I can do something about it, give me a call. Let's set up an appointment to talk about these things and to get you on a better road. So perimenopause. Generally, it starts like in the mid to late 30s for women. It can like be, in the early 40s, but it's usually that late 30s, early 40s that it begins. Now, it can be even later that maybe you, through your 40s, you don't experience any of these symptoms, and then all of a sudden you hit 48, 49, and for a few months you have them. And then you just sort of transition easily. That does happen. And that's kind of ideal and what we're always, hoping to get to. And that's what I often tell women that this, you know, coming into menopause can be like trying to land a plane. We want to land it as smoothly as possible. And that's what I see as my role in helping women to educate you about it, but also to have solutions and things that we can do to make that transition easy. So it can last just a couple of months, but it can also, we can be going through this for maybe even up to 10 years. So that's a lot of time to have some of these symptoms that are not pleasant, which again is why so much easier if you have someone in your back pocket that can help you kind of sail through it. I also like to emphasize that it's kind of demonized, menopause. It has often like a negative connotation to it. And I always emphasize that this is a perfectly normal transition. It just is the transition of your body starting to make and less hormones, especially estrogen and progesterone but primarily estrogen. And so some people, those that just have a few months and then a natural transition, their estrogen decline is just a little more natural and not abrupt. But many women sort of experience these abrupt ups and downs, which can lead to many of the symptoms that we're going to discuss. So the symptoms that I have for our topics today are weight gain. This is another reason why I chose this topic to start with because weight gain um, in this perimenopausal time is one of the absolute number one patient, not complaint, but things that you come in to see me about. What do I do about this weight gain? So I do believe because that's such a big category and I have a lot of women that are dealing with that and it is a lifestyle change that I'm going to make a separate uh, group where we'll meet on Zoom or maybe Facebook. I haven't decided yet, but we'll meet virtually where we can really dive into the weight gain and talk a little bit more about it. What I'll tell you about today is just like the brief overview of why these things happen. But that's my plan. So if you are in that phase and weight gain is something that has become a problem for you, that look out for that group because that is something that I do plan to do, and I've told many of you about that. So weight gain, number one topic. Probably the next major complaint that I get along with perimenopause are the hot flashes and night sweats. Super uncomfortable, terrible. Thankfully, easier solutions. There's a few that I have imparted to all of you that have worked for me as well. So that's something we can get control of. That also leads into sleep disturbances. So that's another topic that we'll talk about. Memory loss and brain fog. This is a big one that when women come to me, they're very concerned about, understandably. Mood changes, fatigue, things like hair loss, dry skin, which also includes, we'll talk about why, but like vaginal and bladder problems, and certainly joint pains and problems can also occur. So, those are the main topics that I'm going to focus on today for perimenopause. Now, weight gain. Um, this is primarily due to the changing hormones. That it has an effect on our appetite and certainly our metabolism. Things start to slow down a little bit. And those hormones that control how and where in our body we store fat. And this is probably, again, like I said, this has been so prevalent the past few years of women with these complaints and like, oh my gosh, I have fat storage in places I've never stored fat before. And it is because of the various hormones, not just the sex hormones, but other hormones that we'll talk about, cortisol and that insulin and the hunger hormones and things like that. All of those begin to change, and that has an effect on our weight. The weight gain that we experience then in turn can also exacerbate things like night sweats and hot flashes and all of those fun things. And again, it's because the added weight, the body has a difficulty dispersing that excess weight or excess heat. We'll talk about that. But the weight gain definitely can exacerbate the night sweats and hot flashes. So, when we gain weight in this perimenopause time, often it is what they call visceral fat, which is what we gain around the middle that pads our organs. Now, it's intended by the body to put that fat there so that we have an easy source of energy should we need it. That energy around the middle is generally easy to release and use when we need it. In the past, when our tribe didn't get enough food, it ensured our survival. However, we don't really have too many issues with that, in this day and age. And that visceral fat tends to remain, and the longer it remains there, it becomes more of a chronic health risk. So, one reason that I want to focus on in a separate group on some of the weight gain, not just for me personally, but also for many of you that have that, so that we can try to optimize our health and reduce the chronic disease propensities that can come along with this visceral fat. So that's important for all of us. Not everybody gets that, and not everybody experiences that. Maybe they gain a little bit of weight, but I would say at least right now, amongst my patient population, that is a major concern. And so some fat deposition is a natural process. What our bodies are doing, and I've said this for years, is that it's working to help to build some of our fat stores because when estrogen in our ovaries decline to making estrogen, the fat cells actually become their own hormone producing system. And it can produce small amounts of estrogen on its own. This is what helps to keep our bones healthy, and it's a natural process to help keep the bones healthy. The bones rely on estrogen production. And so our fat cells, and that's, I'm talking like, 5 to 10 pounds, which some women do put on, which is a common normal process. It's helping to keep your bones strong. It's just, the excess fat accumulation that I mentioned before that becomes problematic. The body also becomes at this perimenopause stage, and this is something I experienced myself, is that the body becomes less flexible as far as your nutrient intake. You're less able to handle sugars and like the nutrient depleted convenience foods that are so prevalent in our society now. We're not really meant to deal with all of that, especially while our metabolism is slowing and things are changing. And so, this, I think, is a huge part of, in our society especially, of why so many women experience more than just that 5 or 10 pounds of weight that the body naturally wants to put on to produce small amounts of estrogen. This is excess calories. It's very difficult for the body to deal with all of the excess when everything else is slowing down because our body's natural tendency is, well, we'll just store it away for later when I need it. The diet and the macronutrients. So macronutrients are what we refer to as proteins, carbohydrates, and fats. Those are the big nutrients. The balance of those and what we're eating, the quality of those foods become especially important at that time. This helps to prevent fat gain and also put in the right proportions can also help to promote fat loss, which is what I want to talk about, in my separate groups, specifically for perimenopause and weight gain and things like that. So our next topic, hot flashes and night sweats. And if any of you have experienced those, you know how terrible this can be. The night sweats especially can be overwhelming because it disrupts your sleep. You often wake up, and it can be a couple of times at night. They can be intense. You can be soaked in your clothes, your sheets, and then you also feel chilly because you've just sweated and now you're uncovering yourself. Many women need to even change clothes or change the sheets or put towels down or something like that. So you can see how this is a huge disruption of your normal sleep cycle. So where we get the hot flashes and the night sweats is that it is triggered by those falling estrogen levels. Also, as I mentioned before, they increase based on increasing fat deposition. So the more fat that we carry around, it makes it more difficult for your body to disperse that heat. And so you have this combination of two things happening. Estrogen is declining. And also, if you have some of that fat gain, it's like you have more of those fat cells that make it more difficult to disperse the heat evenly. So thankfully, there are some, as I mentioned before, there are some easy ways that I have found, especially for the night sweats, that really help women to avoid those or, to completely get rid of those at nighttime. That doesn't mean that we don't have sleep disturbances on top of it. That's our next topic, sleep disturbances. So part of this, if we, set aside the night sweats, that's a whole other problem, like I said, with the falling estrogen. But what also disturbs our sleep is falling progesterone. So the progesterone decrease is also exacerbated by stress. So the story with this goes that cortisol is a stress hormone. So our body produces cortisol from any available progesterone. So if you have that progesterone sitting around, your body is going to take that and convert it into cortisol. If it feels like there's stress, it has that fight or flight response, even though the stress may just be family stuff, life stuff, money stuff, health stuff, what those things that come along, usually around, they coincide the same time that perimenopause begins. Increased stress exacerbates the progesterone depletion because you're needing to make more cortisol, so your body takes more and more progesterone. And in turn, excess cortisol then contributes to the sleep difficulties. It again, cortisol is one of the fight or flight hormones. And it is near impossible, because that's not the idea of cortisol. It's near impossible to fall asleep when your cortisol is high. That goes against your body's nature of what it wants to do. When cortisol is high, it means that you should be on alert to fight or flee. The excess cortisol also, in turn, contributes to weight gain because it's a storage hormone, cortisol is, and it's telling your body that when there is high stress, or if it's in that fight or flight mode, it is more beneficial for your body to store any excess calories as fat. so that it can use it for later. It's like we may be running from something or fighting something, so I need some of that energy stored away that I can pull from. Usually it's that visceral fat that we talked about. I can easily pull from that and use that as an energy source if I need it. So, stress, even though we're talking about sleep difficulty, stress increases cortisol. Cortisol depletes the progesterone, which progesterone in itself is a hormone that it's usually prevalent in the second half of our menstrual cycle. It tends to make us feel better when it's in balance with estrogen. It is an anti-anxiety, and it does help us to sleep better. Like it is more sleep promoting. It's relaxing. So when it begins to fall, that's where we can have these sleep disturbances because of anxiety, perhaps. But we also don't feel as relaxed. Our mind is going, and then we have the cortisol on the other end of it. The cortisol's exacerbating all of that as well because you're not able to fall asleep. So many women experience this progesterone phenomenon during their menstrual cycles. So they often report that about 3 days before their period starts, they actually start to feel, they might feel a little bit anxious. Mood changes can happen at that time, sometimes based on this underlying anxiety, but they also don't necessarily sleep very well the few nights before their period. But once the period happens, usually the hormones are kind of reset back in balance, but it is that declining progesterone level that couple of days before the menstrual cycle starts that is kind of showing us what progesterone does and how it makes us feel. So if you are still menstruating, that might be something to pay attention to. And it's usually 2 or 3 days before the menstrual cycle starts. Do I start to feel like I'm not sleeping very well? I'm up and down, and that I have maybe this underlying anxiety a few days before my cycle starts, because that is what can happen sort of more long term in the perimenopause phase. And like I mentioned, is exacerbated by stress and by cortisol production. So, memory loss and brain fog. This is another one that obviously is very understandably concerning to women. They suddenly start to, and this can be, again, perimenopause starts late 30s, early 40s, and you can be, 38 years old and you're like, I think I'm losing my mind. I'm having word finding difficulty, or I forget what I'm doing. I mean, we all do that from time to time, but many women start to experience this on a more regular basis. So, and it can be experienced differently. Like I said, it can be sort of that word finding. You're talking with someone in mid-sentence, you just completely blank out and you know what you want to say, but you can't find the word for something, or that's very disconcerting because you're like, what is wrong with me? I've never had this. Or it can be that more frequent, you walk into a room, what am I doing in here? What was I planning to do? What am I forgetting? And have to retrace your steps. What was I thinking of before? All of that. So some women can have all of those. Some women just experience little bits of that. But again, it's understandably concerning. But the underlying reason to any of that is those falling estrogen. Usually it's the estrogen levels, but also progesterone can contribute to that. Again, because it ties into that lack of sleep. It is the memory loss and brain fog is exacerbated by the lack of sleep, which that would make anybody, sort of forgetful and all of that. But these two coinciding at the same time with the lower estrogen and progesterone levels and then lack of sleep, definitely makes us feel like we're, early stages of some type of dementia. And not necessarily so. It may be explained simply by the hormones, and that gives us a clue of what we need to do about it. Um, that can also lead into mood changes. So all of these things, we're talking about the symptoms of perimenopause. So the mood changes, the irritability tends to be the one mood that tends to shine in perimenopause. And it can be at an intensity level that is so alarming because you say, I don't feel like myself. This is not my usual response. Or that trigger for irritability is so instantaneous and can be so explosive and intense that your family members wonder what the heck happened. You're wondering what the heck happened and why your response is that way. And it can be just over little things. So the mood changes, like I mentioned before, with the decline of progesterone a few days before the menstrual cycle, gives us a clue of what some of those mood changes can feel like, because oftentimes we feel that in our menstrual cycle as well. Um, Oftentimes you also feel maybe a little bit more tearful, and that can have a role, but like I said, the intensity is usually more that women see in the irritability and how they respond to situations. So the mood changes exacerbated by these falling hormones, as well as fatigue and lack of sleep. Anybody that's had a night of terrible sleep knows that we're not necessarily at our best and we don't feel so bright and hopeful the next day. And then if this is continuing for many nights in a row, you can easily see why the mood changes become problematic. So this leads into fatigue. Obviously, fatigue can be for many reasons, and it's not just limited to perimenopause. Often there is an increase in fatigue. It's exacerbated by declining hormone levels, surprise. But oftentimes, when fatigue, it's probably another number one patient complaint overall that I experience, and that I help people with, because there are so many different reasons why fatigue can play a role. But how it fits into perimenopause is that, we'll run labs for thyroid to make sure that's still on par. The iron levels and ferritin levels, that certainly can contribute to fatigue. And certainly, we also want to discuss diet, including getting enough protein and the right types of carbohydrates, because again, that feeds back into the weight gain that can start to happen at this time. If our bodies just need different fuel to run on, it needs a little less fuel than what we're used to, and it needs more of the good sources and nutrient dense sources of those types of nutrients than we've necessarily ever required before. And so even lack of protein for some people can be the only reason that they have, exacerbated fatigue. And once those are, or maybe the right type of carbohydrates. So sometimes we need that in there as well. I think I was going to backtrack too about with some of the anxiety. Maybe it'll come up here because we often talk about um, stress and how that effect that it has on our body for anybody, not just perimenopausal women, but stress exacerbates fatigue by depleting the adrenal glands. So I discuss adrenal gland health with nearly every patient, I feel like, because our society, we do have a lot of stressors and we don't even necessarily recognize that that's what that is. And because stress has such an effect on the adrenals, which have an effect on the entire body, that becomes very important. So, um, dealing with stress, and like I mentioned before about stress promotes cortisol, which depletes progesterone, which contributes to sleep difficulty. Like, see, we're just in this big cycle. So this is an important time, perimenopause time, for adrenal support. And some people say, well, I don't feel any more stress than I did before, and perhaps not, but often by that stage in life, we've had enough stress, and you're never going to go wrong with supporting your adrenals and giving them some love, because they do need some of that support. So, Sometimes if that's the only reason why someone has increased fatigue is just because their adrenal hormone production is also declining a little bit. We just don't have the reserves because stress has put so much pressure on the adrenals. Then, hey, they feel much better just by adrenal support. And the adrenals, when they're in balance, they're helping the rest of the hormones to also reflect some of that balance. So, always a good thing to do that. So that's why I talk about it so much. Most of you have probably heard that before. Hair loss is another common, well, I wouldn't say it's as common as the other ones, but it does come up around this perimenopause time. So, as men often know, this is usually caused by a decline and in hormones and directly related to that hormone decline. Hair loss can also be due to factors such as thyroid dysfunction and low iron and ferritin. So, those are things that we can check on labs. We can check and make sure the thyroid is optimal, that your iron and ferritin levels are optimal. Once they are, then we might look to nutrients. Are you getting enough nutrients? Do you have enough minerals and things like that? Are you using things like antacids that can block our body's ability to absorb nutrients? All of those can contribute to hair loss or our nails not functioning as well, or they tend to be more brittle and break easily, hair and nails. This also, with hair loss, this is again looking at stress because stress can contribute to hair loss. And so all of those things we have to take into consideration, but this is again feeds back into why adrenal support can also be a positive thing if it's primarily driven by stress. The another thing that most women, it kind of sneaks up and you don't necessarily notice it at first, but then it becomes apparent that dry skin is a problem. This is for over the whole body, and we also include the skin of the vaginal canal, and all of that skin becomes a little bit more dry, less pliable. We start to get the appearance of the fine lines and wrinkles around the eyes and the mouth and things like that. So, estrogen is an important factor throughout the body for providing moisture to the skin cells, including, like I mentioned, in the vaginal canal. So, when it starts to decline, that's when we start to notice a difference in the texture of our skin cells throughout the body. So this leads to, as I mentioned, inside the vaginal canal, that it is the a same phenomena that it's due to this lack of estrogen production, which is again a normal process, but sometimes that decline can happen so rapidly that it just things can suddenly change. It can also be, as I mentioned, a slow change where suddenly we realize like, oh, that's, that thinning tissue, it's dry, it's thin, and especially when it's in the vaginal canal, that also leads to some potential sexual issues. And it becomes painful and uncomfortable because the tissue is not the same. It doesn't have the same pliability or the same amount of moisture in it. So I found over years that most women experience this, but they sort of whisper it to me like they feel embarrassed about it. And but then they start to feel better when in a sense of relief, I suppose, when I tell them like, "Oh, that's actually very common. It's normal. This is what we normally expect." And but there's things that we can do about it to help to relieve that dry skin throughout the whole body, but especially in the vaginal canal because the other importance of that is that dry skin in the vaginal canal can lead to increased urinary tract infections. Some of them we don't even necessarily, they're atypical. We don't necessarily experience it like a urinary tract infection, but it can be this low level infection happening all the time. So the lack of estrogen, how much time do we have? The lack of estrogen thins the tissue really between like the rectal tissue, which sits right next to the vaginal tissue, which sits right next to the urinary tissue. So all of those are in close proximity. And when the lack of estrogen, it's not there to plump up those cells and sort of push those tissues farther apart. It makes it easier for some of that rectal tissue to be very close to the urinary tract. And bacteria, such as E. coli, they're normally occurring in the rectal tissue, but it is not supposed to be normally occurring in the urinary tract. And it's easily transferable when all of those tissues are closer together rather than, farther apart like they are in our younger years when we have estrogen providing that service for us. E. coli is the most common culprit of urinary tract infections in this manner. And so this is why women think it's kind of funny that they come to me with urinary tract infections and I focus on, well, let's do a little, let's do some things that remoisturize the vaginal area, because that is helping to separate those tissues and put more distance. So it makes it a little more difficult for that bacteria to get from one place to another. This is also the importance of a probiotic formula that is specific for women. The one I use most often and have probably recommended to most of you, my female patients that are watching, that they contain large amounts of the bacteria that normally colonize in the vaginal canal, as well as in the urinary tissue. And this helps to outcompete the E. coli. So that will help to prevent urinary tract infections, along with that estrogen that helps to, uh, increase that distance between the tissues to make it a little bit more physically impossible to transfer one to the other. And last but not least, the thing I want to touch on is the joint problems. These women start to experience more joint pain, and that's primarily due to the decline in estrogen and progesterone. Again, a phenomenon that some women experience at the very end of their cycle and the beginning of their menstrual cycle because those hormones are low. Oftentimes they experience it even after childbirth when the hormones are lower as well. So, and diet can really contribute to joint issues, various things, proteins, not enough collagen, not enough vitamin C, all the things that go into joint health. So, to end, what can we do about all this? Because we see all these problems. We hear it's a natural process, but what are we supposed to do? We can actually do a lot. I run labs so that we can make sure that we're optimizing everything that we possibly can, things that we can pick up on the labs, like the thyroid and iron levels, as I mentioned. We certainly address stress and look at adrenals. That's why so many of you probably get tired of me talking about adrenals, but that is one thing that we do. We're addressing the adrenals and our stress levels and those how because it can have an influence on the whole rest of the body, as I've mentioned before, and dealing with stress to help to bring down those cortisol levels and the other stress hormones. We certainly discussed nutrition. Nutrition is so important. And like I said, at this stage in our lives, having good nutrition and the proper forms of nutrition and really nutrient dense forms of all of the foods that we eat, those macronutrients, becomes very important to help address many of these things that we've discussed and those symptoms that we are uncomfortable that we don't want to have. I often use herbal medications, homeopathics, um, other nutrients that might address your particular situation. That's what I do as a naturopathic doctor. We're trying to incorporate all of these things, integrate whatever we can that are easy, simple, natural solutions that can promote that. Which we also often look to some of the bioidentical hormones. At this stage, the perimenopause stage, it is okay to supplement the body with some of those hormones. Your body's used to being exposed to the hormones, and sometimes with using those bioidenticals, we can begin to decline them a little bit more naturally, especially if it's just sort of been a sudden decline, which is, uncomfortable. So we we typically will address those hormones in some fashion, and it is perfectly okay and safe to do that in this phase of life. If you're already postmenopausal for, 10 years or so, it's not always the best choice just to throw in, a bunch more hormones. So we take it on an individual basis, of course, and assess your particular situation and the symptoms that you're having, to see what, the best course of action is. So I think that I am about out of time, and that's what I have for you on perimenopause. So going forward in the future, certainly send me questions, even about perimenopause. I can address that in a future lunch and learn. I look for the one that I'm going to have that is a separate group specifically for perimenopause women and weight. That will be our primary focus. And you can always send me questions. You can send me other topics that you'd like to hear. And I hope to keep the same kind of format, perhaps more back and forth and interactional in the future. So it was great to see those of you that could join, and let's just kind of keep going with this and it'll develop from here. All right. It was good to spend the afternoon and lunch with you, and we'll talk again soon.